Ryan, welcome.
I'm here.
Please,
Thank you.
please talk about digital communication and all that stuff.
That sounds great. And Dr. Jewell, if you'll advance that first slide, we'll go ahead and get started there. So when we talk about communications really quickly here, I want to dovetail on what Mary was just sharing with you. I think the first thing you have to prioritize is the communication that you get out to those patients who are already on the books. I understand, I think very, very well that you're in triage right now, that there are a lot of fires that are calling for your attention, but taking the time to go back to those people who had previously scheduled, whether they were surgical or non-surgical services, so that they understand what the disposition of those services is going to be will be eminently important. Obviously, those are the cases that you want to preserve, that you want to be able to drop right back onto the books when this all resolves. And so having a really clear policy about how you're going to have that, and then that opportunity to make that personal connection will be important. As Mary mentioned as well, this is the time to take a look at those policies that make a lot of sense in different times, but that may not be as sensitive or empathetic to what people are dealing with right now, and potentially revising those policies and taking a look at where you have those in writing and circulation, updating not only your staff and their awareness, but the public presentation of that information so that people who are uncertain, what will happen if I have to cancel or reschedule appointment? What will my penalties be? Getting that information out to people proactively will diminish that fear, strengthen their relationship back to your practice, increase the likelihood that you're going to be able to get those people back onto your surgical schedule or your non-surgical schedule when you can begin to see patients again if you're in one of those regions where you are prevented from providing services today. Now, during this period, even though you may not be able to deliver procedures, you will still be expected to deliver service. So stepping back and assessing kind of the minimum viable staff that you'll need to support email and phone-based inquiries. People will be calling in, obviously, for questions about how you'll be addressing follow-up, what's going to happen with their appointment. They're, of course, interested, as we've already alluded to, since they're idle, right? Now, in theory, would be the perfect time to get treated if things were a little bit different. Yeah. But they're going to be expressing an interest in service. So making sure that you have someone who can, in a timely manner, respond to emails, watching closely for those, probably we would refer to them as atypical communication sources, like your blog, making sure the staff is aware and receiving alerts when those messages are coming in, and of course that you continue to deliver great telephone service. Now, at the same time, this is a chance for you to really demonstrate your leadership and communication and keep in closer contact with your patients, maybe even than you have during these richer times that we've enjoyed the last few years. Making sure, first and foremost, that you have a platform. We recommend a blog post that is, at any given moment, clearly describing how your office is responding to COVID, so that you have a place to send everybody to get the latest information if they can't immediately reach your staff. Deploying a site-wide pop-up is the best way to get people to that information. So a simple slide up, slide down, or pop over announcement that links to your COVID-19 update is going to be a really important thing to do. Now, beyond that, take those platforms that you used for promotional communications in the past, turn them into a vehicle for you to get that outreach messaging to your clients. So use your email marketing, use regular blog posts, specifically on-brand blog posts, to call people's attention to how you're responding to the situation. And don't be afraid during this period to have a little fun, to let your personality and that personal connection that you aspire to have with patients come through, especially in social media. Now, look at places that may allow you to diminish the demand when you have a diminished staff. So on-hold messaging, your email signature file, all of those things, if you push people over to that blog post, you can help people self-service and to calm any concerns that they may have and find instant access to more information about how you're responding to COVID. So if you would, Dr. Jewell, let's go ahead and move into the second slide there. We'll talk a little bit about virtual appointments, how and where you're going to be able to support those patients who are interested in staying connected right now. Now, there are really three things if you aren't already an aggressive user of a virtual consultation or a virtual appointment schedule. Three things that you need to be thinking about. First, you have to solve for making patients aware of this and how you're going to allow patients to signal you. We recommend very simply that you prominently display across your site. It can even be a part of your general messaging. And Dr. Jewell, if we can bounce back on that slide, that'd be great. Making patients aware on your site that you offer the virtual consultation as an option, and modifying your consultation request forms so that patients can express to you that they're specifically interested in the virtual appointment. That checks that first box there. The next thing that you have to address is the need many of you are going to have for some kind of secure file or information transfer. Now, important to note here is that email is inherently insecure. Email is not a HIPAA-compliant vehicle for communication. And so if you have patients, for example, from whom you need a patient registration form or a health history, it's not safe for you to ask them to simply email them to you. Similarly, some of you are going to request, because you don't necessarily want to jump onto a virtual consult with just anyone, you may request some kind of pre-consult or assessment step in advance where you invite patients to send you photographs of themselves. These are breast and body photographs. Obviously, we have to be concerned with those images as well. So 2 things to advise you here. Number 1, have a conversation today with your practice management software vendor if you don't already use their secure patient portal. This is typically going to be the fastest and easiest way for you to get that health history and that registration data that you're going to need before you can have that consultation. And if you do require that the patient send to you photographs in advance, talk to your digital agency or find another solution for both secure and encrypted file transfer. What we want to have happen is we want that data while it's in transit to the office to be fully encrypted. And your normal SSL forms, the thing that adds the S and the little lock to your website, doesn't actually encrypt the email when it's on its way to your office. The last thing you need to solve for, that third point, is just a video conferencing solution. Now, important to note that the major platforms like Zoom, Skype, GoToMeeting, they all do have HIPAA compliant options, but they may require you to jump through quite a few hoops before they're willing to sign off on a BAA. Skype in particular, which is owned by Microsoft, is a little bit of a bear. But we've done a bunch of research really to benefit our own clients, and I'll share the findings there. We looked at a bunch of different tools, we stress tested them, and found a great one for free. It's called doxy.me that we recommend that folks check out. There are a bunch of the popular industry players in plastic surgery who are coming out with tools very soon. This is one that's available right now. It's tested and it's working, and they have a great zero-cost telemedicine option that we think is something you need to look at. Okay, third slide here, Dr. Jewell, if you don't mind advancing me to that last point. We'll talk a little bit about marketing, and I want to be very careful and understand I'm not at all tone deaf. I know for many of you it feels very much like a life and death situation, so I'm certainly not promoting marketing. I want to take a second, though, to highlight a few of the things that I think you need to understand to make responsible decisions right now. So when we talk about SEO and local optimization, what's worth mentioning here, I've been doing this for about 25 years, and what we found consistently is when you go idle in search engine optimization, no significant content enhancements to your site, no new link development, after about 3 months, we start to see those rankings decline. And for extended periods beyond that, we see the loss of momentum, and that may actually be the harder part of those 2 risks. As you lose momentum in search engine optimization, it can take 6 months or more to regain it. And so 3 months of idle could actually mean 9 months of decline before you start to see things turn around. So just take care there and be smart about how long you actually pause those investments. Be aware that this isn't going to last forever. We are going to want to come out stronger on the other side, so you have a strong pipeline to fill your practice calendar. Now, email marketing and social posting, those should be tools that you look at closely to keep in contact with your patients, making them aware that you're there, that you care about them, and how you're responding to the evolving situation with COVID. Great opportunity for those of you that have been handing off social media participation to members of your team or an agency to get more involved personally. Now, interestingly, for those of you that are involved in Google Ads, Google has a built-in disincentive to stop your advertising. I don't think it's enough of a disincentive to stop you altogether from walking away from this, but you should be aware that they have this thing called quality score, and the moment you pause an ad group, they basically reset it. The implication for you is if you stop and start ads several times, every time you stop, it sets that quality score back to 0, meaning you're going to pay as much as possible. Your ads will run as inefficiently as they could for the several weeks to several months after that campaign pause and restart. So just be mindful there. If you do have to stop, it's better just to wait, start them back up again the moment that you're ready to invest in PPC for good. And one of the biggest questions we're getting from our clients right now is how to make the best use of that idle time. We have a white paper that we've just published with 12 different tactics that you should be considering for this really unique period in our history. We'll be making that available for free for everyone who's registered for the call. So, and it's available for members right now on Radar.
Thanks, Ryan. I want to remind everybody who's logged on that we are going to have a lot of Q&A of the things that you want to hear about that you've sent in at the end of the presentations. So just because we've limited the Q&A in between speakers doesn't mean that that's the end of it. Ryan, I have a question, and I know others have mentioned that there was some discussion that HIPAA rules will be relaxed for a while. I find that hard to believe that plaintiffs' attorneys will honor that in the future. Tell us about that.
Yeah, so again, I'm not a lawyer, but I'll tell you what we do. We've consulted our own counsel, and their interpretation on those guidelines are effectively that the relaxing of HIPAA is specifically for situations, largely for hospital-based communication, where you have large number of people who are affected by COVID-19, and the hospitals have a need to communicate with family members. I can bet, and there we have two legal experts, I think, that are on the call with us right now at the very least, that they would echo what I'm about to say, which is that's not meant for you. So you still need to take reasonable measures to protect patient privacy. And it's a good idea that you look for those HIPAA compliant measures to support your virtual consultations today.
Renee, do you have anything to add to that, being the attorney? Okay, well, Renee unmutes and comes.
I was on mute.
Okay.
So I will just say that for telehealth, there are some enforcement being relaxed for telehealth requirements under HIPAA. There is still uncertainty as to exactly who that will apply to, whether it would just be the hospital setting. So I think there are more regulations and rules to come in that regard. For now, I would say an encrypted HIPAA compliant platform is your safest option.
Bob Aker, just who's the legal counsel for the Aesthetic Society, just made a notation that the HIPAA rules have been relaxed for telecommunication. The specifics of that, and what that means, and for how long, and to what extent, I think we need to get a lot more information, and perhaps we'll have that in the subsequent webinar.
And Dr. Singer, if I could,
we don't want you to run afoul of problems. Go ahead, Ryan.
And I would just say, I don't think right now there's a significant reason to worry about relaxing it, because there are so many freely available tools that are fundamentally HIPAA compliant. The biggest challenge that practices have to solve for is that encrypted file transfer if they're inviting patients to send things like health history and patient registration data by email. I would say that's your biggest risk, so don't do that.
Okay. A couple other things. We're being inundated from companies suggesting go to them for telemarketing. They have all new platforms. All of the practice management has them. It's very difficult for us as individual physicians to sort that out. Give us some advice.
Yeah, I think the biggest consideration right now is most clinics are going to have ready at their disposal the tools they need for the communication that's most important right now. Hopefully you've all been responsible in building a consent-driven email marketing list that you can send communications both out to your patients and your prospects. Obviously, as you're communicating with patients about their individual appointments, those that were already on the books, you should have their personal contact information that you can freely use to communicate with them. And in terms of thinking about the bigger picture, certainly in the next couple of weeks, you'll all have a chance to catch your breath and begin to have conversation with your agency partners about building your pipeline. We want to make sure that once the dust settles, once you can manage your initial reactions to the crisis, you can then start to shift and be what your team needs you to be, which is that strategic thought leader, and have conversations about how do we come out of this strong, and what types of marketing communication do we have to do. So don't worry that everybody's flooding you with promotional messages right now. Focus on supporting your team and your patients. And then over the next couple of weeks, you'll have a chance to worry about building that pipeline.
I have one more question, and that is,
And then
you've
I have
talked
one
about,
too.
you've talked about increasing or spending the time with additional marketing material on your websites, on other things. In today's climate, where a lot of patients will have lost their job, they've lost their business, they have, all of us are going to know people who are sick or in the hospital with this. How does that message of us really pushing out elective aesthetic procedures, how is that perceived in the public? Is that going to be a negative perception of us, and is there going to be a backlash about that?
Yeah, I think the bigger risk right now is taking care that messages that go out specifically in relation to COVID-19 don't come off as overly promotional at a time where patients are in fact sensitive. So the distinction that we're making is communication about your practices in response to COVID, how you're supporting your staff, your patients, and your community, as opposed to directly promoting procedures. And I think you can right now live inside of a messaging space that's really about informing, educating, and staying connected to your patient base. The other thing you have to acknowledge is your target audience has a tremendous amount of time right now. So this can be a great opportunity for you to use the platforms that you still have available to you, the email marketing, your social media, to educate with them, to let them inside and see what it is that you're dealing with, to connect with you personally, and to share a little bit about how you're responding to this really unique period.
Those are great.
Form those connections.
There's a lot of information,
but
but I'm going to ask Mark to ask his next question so we can move on, because we
Sure.
have so much to cover for everybody.
Thank you, Robert. Ryan, what about YouTube videos? What kind of content would resonate with patients right now that, can be homespun, by our colleagues?
Yeah, so again, I think things that are really sensitive to and genuine to the situation that we're all sharing together. I'll share a thought that's inspired by a conversation that I had with Dr. Samuel Jr. just this weekend. He's in a market where in his state, there's a prohibition against elective procedures, but he's aware that many clinics in the area and med spas continue to offer them. So, for example, a public service video where you're educating your marketplace about why it is that the decision's been made in your state or in your community to enforce specific prohibitions or restrictions, to demonstrate what good citizenship looks like, and to develop empathy for why it is you're choosing to follow the law. That's going to work well. The other thing that's going to work well is social video content to let people inside your world. How are you and your family and your staff responding to what's happening right now? What are you doing to fill your time to stay sane and to stay educated? Those kinds of things are also going to be incredibly effective in your social channels.
Thanks.
Good idea.